almost anybody that has a loved one that has a problem with a substance use disorder or a mental health disorder has heard the words tough love. They've probably heard it as often as they hear you've got to want help, ask for help, or hit bottom. Tough love comes from the old style of interventions by way of Vern Johnson. That is basically ultimatums and coercion. What we use today is far different and far more effective, and it's called accountability and transfer of ownership of the problem back to its rightful owner. And what we're saying is that if somebody wants to destroy their life, if they want to act out behaviorally, if they would choose to use substances and or consume massive amounts of alcohol, if they don't want to advocate for their own care and be med compliant for their mental health disorders, they have that right. And you as the family have an equal right to not put up with it. And you have the right to set boundaries. And you have a right to hold people accountable. It goes to detachment, where we love the person, but we don't like what they're doing. And that's why we have a family program, is to help families detach from their loved ones' addiction and behaviors and mental health, but not necessarily, use ultimatums or coercion. I mean, coercive methods of interventions are very destructive, very risky, and can backfire if not done by trained professionals. So when you hear that word tough love, it's not that old way of thinking. Because somebody, your loved one for that matter, is not going to fix a problem that they don't believe is theirs. And as long as they're walking around full of resentment and hostility, blaming you and everybody else for their problems, they don't feel they're the ones that need to change. And as long as you allow that to continue, that lifestyle, that existence of them running the show, then they are going to do just that, and that is run the show at your expense. So rather than just say, hey, what you're doing is wrong, the heck with you, you have to stop allowing yourselves as the family to be the whipping post of their addiction and or consume your day with every thought of what it is that you can do differently. So tough love today is what we call accountability. And what we're doing is we're handing the problem back to them so that they can own it, because nobody's going to feel the bottom, want help or ask for help unless the problem is theirs and they have to address it. So yes, when accountability is instilled, it may mean them losing things or things being taken away that are keeping them comfortable. But the difference is tough love confirms their theory that you're the problem. Holding them accountable takes away as you being the reason why they are in the position they're in. And I want you to think about that. An ultimatum will make them more hostile. Tough love will make them think, see, it is them, look what they did to me. Accountability is, they may think that for a while, but that will change in their mind to, I did this to myself, I am now in a deeper hole, my consequences have become greater than my perceived benefits, I have to do something different. Because your loved one's not going to make a change unless the consequences become greater than the benefits. So when they're held accountable, I need them to have something to fix that they own. As long as it's you that's the problem, which you're not, but that's what they think, don't forget that, then it's always going to be them trying to change you and you thinking you need to change them. And that doesn't work. We need to hold them accountable. We need to drop the tough love, and we need to set boundaries, and we need to detach, and we need to join our own recovery as family and let them follow behind.